Hello everyone. A very good afternoon to all of you. Am I live? Give me a minute to confirm. If I'm live, I will start the session ahead. It will take few seconds for confirmation. Priyanshi, am I live? Can you give me a thumbs up if my video, audio, everything is good? You can see my PPT, video, audio. Is everything good? I guess it's working. Give me a minute. Yes. So the audio is also good? Yes. So I welcome you all for today's session. A very good afternoon to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take a very important topic on high demand of students. In pathology, I am going to teach you shock. So today I am going to teach you shock, right? So it is a topic from hemodynamics, general pathology. Many students demanded me they have difficulty in understanding the pathophysiogenesis of shock, right? So today we are going to understand all about shock. So if you are a second prof MBBS student going to write your university exam this year, it is a probable question which can come for long question in your paper 1 of pathology. Very commonly shock is asked. Very commonly, I cannot say that this year it will ask in your university or not, but very commonly it is a long question, right? And there are 3 types of shocks I am going to teach you today. You can get a short question on one of them, right? On hemodynamic shock, on septic shock, right? So you can get a short question also, you can get a long question also. And if you are not a second prof MBBS student, you have already cleared your MBBS and you are intern or post-intern now, preparing for any of the competitive medical entrance exam like NEETPG, FMGE, NICT, NEXT or USMLE, anything. It is a very high yielding area from which many MCQs are asked, right? So without wasting any further time, let me start shock. Now let me tell you frankly, students even don't understand what is shock. So first you should have understanding ki shock hota kya hai. If I ask you shock occurs in which organ of the body, you must answer me, ma'am, it is a multi-organ disorder in which multiple organ failure occurs. So what is basically shock? Listen, I would like to draw a diagram for you. This is an organ. Human body is made up of organs. This is any organ of human body. All the organs are supplied by pure blood with the help of arteries. These are the arteries. Arteries divide into capillaries, supply the pure blood to this organ. By pure blood, I mean oxygen and nutrition, right? Now, the oxygen and nutrition is given to the cells of this organ, in exchange of which carbon dioxide and waste products is taken. In this way, the pure blood is converted to impure blood. In the capillaries only, the pure blood get converted into impure blood and it is collected via veins. We all know this. Right? Now imagine a situation, the artery got obstructed. Either the artery got obstructed or the vein got obstructed. What will happen? Pure blood will not come. If the artery is obstructed, pure will not come. And if the vein is obstructed, impure will not drain out. Right? In any of the situation, this organ will lack oxygen. This organ, the cells of this organ will not have enough oxygen. If the cells of this organ will not have enough oxygen, the cells of this organ will face hypoxia. This condition is known as hypo. Hypo means less. Oxia means oxygen, less oxygen. Hypoxia leads to ischemia. Hypoxia leads to ischemia. Ischemia leads to infarction. And infarction leads to necrosis. Necrosis is the death of the cells of the organ. So ultimately the cells of this organ undergo dying. Now this organ have numerous cells, multiple cells. So cell by cell death goes on and that portion of the organ is dead. And gradually the complete organ failure will occur, right? Now this occurs in one organ. Imagine a situation in human body. Let me draw a human body, a rough diagram of human body to explain you. This is a human body. How many organs are there? There are numerous organs. We all have brain, we have lungs, we have heart, we have intestine, multiple organs, muscles, bones. Imagine a situation if all the organs receive less blood due to any condition. All organs, multiple organs of the body receive less blood. Now, I will tell you 3 situations when all the organs receive less blood. So, all the organs undergo hypoxia, the cells of the organ, they all undergo ischemia, they all undergo infarction and they all undergo necrosis. So, they all undergo organ failure. That is multi-organ failure and this is known as shock. So, the patient is in shock. You got my point? So, shock is not a single organ disorder. It is a multiple organ disorder. So can I say shock is a clinical syndrome? Yes. The definition of shock is it is a clinical syndrome that results from Poor tissue perfusion. By perfusion, I mean the blood supply. The blood supply to the tissue, to any organ is poor. The blood supply is not sufficient. Maybe 0 or maybe less. Maybe less. It is not sufficient. So in this condition, what will happen? In the body do not receive enough oxygen, no nutrients. So the cell will have hypoxia. First, the cell will have hypoxia, then ischemia, then infarction, then necrosis. It leads to cell failure. First, one cell will die. Then multiple cell of that organ will die, so organ failure. Multiple organs of the body, finally whole body failure, ultimately leads to death. So it is a step-by-step process. It is not a single step. First cellular death, then organ failure, then multi-organ failure, then the person will die. This is the pathophysiology of shock. Yes, Priyanshi, Osama, very good. Yes, give me a thumbs up. You got it. So this is the definition of the shock given in books. Don't learn it. Don't mug it up. Just understand. So how you will define shock in your exam? So shock is important for vivas also, right? So you should be able to answer it confidently that shock is not a disease. It is a clinical syndrome which results from poor tissue perfusion. This is the biggest thing in the definition. To poor tissue perfusion is there. That is, the blood supply to the organs is not good. I will tell you the reasons. This lead to, you start the sequence. This will lead to hypoxia, ischemia, infarction, necrosis. It will lead to cellular death. Cellular death lead to organ failure. One organ failure then followed by multi-organ failure. Multi-organ failure, whole body failure. Whole body failure, the death of the person. Give me a thumbs up. This is the definition of the shock. So if you all understood the definition of the shock, let's come on the classification. So as I have told you, there are three main types of shocks. The three main types of shocks, and other shocks are also there but not very important. In the others, I will enumerate some more, right? The most important three types of shocks are hypovolumia, cardiogenic shock and septic shock. In all these three shocks, all organs of the body receive less blood. I will tell you the reason is different in each of them. Ultimately, the summary is this. In all the shock, this is happening. In all shock, ultimately all organs receive less blood, less perfusion. But the reason is different. So let me talk about the three types of shock one by one. This is the classification. Now, let me talk about the first type, hypovolumia. So as the name indicate, hypovolumia. How much volume humans have? Blood volume. We all have 5 liters of blood inside us. The adult human body, we all have on an average 5 liters of blood inside us. This is normal volume. This is known as normovolumic. Normal volume hai hamare andar, right? But due to any reason, if we have hypovolume, तो blood ही कम है ना. So that organ is receiving less blood क्योंकि body में blood ही कम है. Instead of 5 liter, there can be 3 liter, there can be 2 liter. Now you will say, ma'am, why the volume is less? There can be some road traffic accident, imagine, and person is bleeding heavily from all the parts. Imagine a person is traveling on a motorcycle and he is just having a road traffic accident and he is bleeding. So most of the blood is already bleeded out. So he is having less blood in the body, so acute hemorrhage. During the surgery it can happen. During accident it can happen. Acute hemorrhage can occur anytime. The second reason, hemorrhage is not there, but due to diarrhea or vomiting, most of the fluid is already out of the body, either in vomiting or in diarrhea. That can happen, right? Burns, in burns dehydration occur. In burns, actually there is heat to the body, right? Heat to the body is known as burns. So due to heat, the water evaporates. The water from the body already evaporates from the heat. So person can go in hypovolumia, right? Excessive use of diuretics. Diuretics are the drugs. They increase urine volume. So most of the fluid, most of the plasma is excreted in urine. So excessive use of diuretics can lead to hypovolemic shock or acute pancreatitis. These can be the reason in which patient have less than 5 liters of blood in the body, and this is known as hypovolumia. Yes, obviously anemia will occur in the shock. No? In this type of shock, definitely anemia will occur because I am saying hypovolumia. So person have less than 5 liter of the blood. Basically less than 5 liter of the fluid. And blood contains hemoglobin. If less blood is there, so less hemoglobin is there. Less hemoglobin means anemia. So it will, of course, the patient will be anemic, of course. Right? So this is the thing. You got it? The meaning of the hypovolumia. What is the meaning of hypovolumia? Yes, Vardhan, the classification is important. In exam classification also, if it is a long question, you have to write everything, Vardhan. You have to write definition, then classification. In classification, take one by one and then tell the etiopathogenesis of each type and clinical features of each type. So that is how you have to go on, right? Give me a thumbs up. Yes, Priyanshi. Yes, the reasons you have enumerated, absolutely right. These are the 5 reasons of hypovolumic shock. Don't learn, understand them. क्या क्या रीजन हो सकते हैं बॉडी में कि 5 लीटर से कम ब्लड हो जाए? ऐसे क्या क्या कारण हो सकते हैं? या तो ब्लीडिंग हो, या तो डायरिया हो, वॉमिटिंग हो, बर्न्स हो, एक्सेसिव यूज ऑफ डायरेटिक्स और पैंक्रियाटाइटिस. इन सारे रीजंस में ब्लड में लेस देन 5 लीटर ऑफ ब्लड कैन हैपन, वॉल्यूम कैन रिड्यूस. द सेकेंड टाइप ऑफ शॉक is cardiogenic shock. It is also known as normovolumic shock. Normovolumic shock. Here volume is normal. The volume is normal. Then you will say, ma'am, why the organs are receiving, all human organs are receiving less blood? Why? The volume is normal. Just suppose the patient have 5 liters of blood, but the heart, the left ventricle of the heart is not pumping. You know, when the left ventricle pump, this is the right ventricle, left ventricle. This is left side, this is right side. So left ventricle pump, so blood goes in aorta, the pure blood. And this pure blood is supplied to all the organs throughout the body. Imagine a condition, this left ventricle is not pumping. There is left heart failure. The patient is having left heart failure. It is not pumping properly. So less blood will come in aorta, the pure blood. And less blood will be given to all organs. So all organs ultimately receive less blood. Less blood means less oxygen. Less oxygen means hypoxia that can lead to infarction, ischemia, necrosis, cell death, organ death. So the sequence will start. You got my point? But here, patient have 5 liters of blood. Still, all the organs are not receiving the blood properly. You got my point? So this type of shock is known as cardiogenic shock. You got it? Priyanshi, you got it? Others? Vardhan, you got it? So everyone give me a thumbs up. This is known as cardiogenic shock. So why the left ventricle will not pump properly? Why? Tell me the reasons of cardiogenic shock. So what can be the reason? Either the person have myocarditis, inflammation in the left ventricle, right? Or the person can have some infection in the left ventricle, or the person can have MI, no? Infarct or MI can be there in one portion of the left ventricle. So there can be myocardial infarction, there can be cardiomyopathies, there can be rupture of the wall, there can be arrhythmias, right? There can be cardiac tamponade. These all are reasons of cardiogenic shock, right? And the third shock, the third and the last type of shock is septic shock. We all know the meaning of the septic. Septic means bacteria in blood. Bacteria in blood is known as sepsis. Now, why, if the bacteria in blood is present, why all the organs of body receive less blood? That I will tell you separately when I will tell you the details. But this is of two types, gram-positive septicemia or gram-negative septicemia, depending which bacteria is present in the blood. Whether gram-positive bacteria is present or gram-negative bacteria is present, right? So till now, I told you, and others type of shocks are there like traumatic shock, neurogenic shock, hypoadrenal shock. So you just enumerate them. Till now, I told you shock, the definition of shock and the classification of shock. You all know how to define shock. Shock is not a disease, it is a clinical syndrome which occurs due to poor tissue perfusion. It leads to a sequel. Due to poor tissue perfusion, there is hypoxia. Hypoxia leads to ischemia. Ischemia leads to infarction. Infarction leads to necrosis. Necrosis leads to cell death. Cell death leads to organ death. Organ death leads to multiple organ failure, and then the complete whole body failure, and ultimately it leads to shock. So it is a big flow chart, right? That is the definition, right? After definition, if you talk about the classification of shock, I told you 3 types of shock. The main 3 types of shock: hypovolumic shock, normovolumic shock, which is known as cardiogenic shock, and the third type of septic shock. In each type, you have to further tell me the causes. Hypovolumic shock is due to acute hemorrhage like road traffic accident and all, surgeries and all, right? It can be diarrhea, it can be vomiting, it can be burns, right? It can be diuretic use, it can be acute pancreatitis. Cardiogenic shock, tell me the reasons. It can be MI, cardiomyopathies, cardiomyocytis, cardiac tamponade, all the things which can involve left ventricular failure, which can lead to left ventricular failure. And septic shock is only of 2 types, gram positive, gram negative. So I will tell you the details of each of them. Everyone give me a thumbs up. Can we go ahead? Yes. Everyone with me. So till now we understood the definition and till now we understood the classification. Yes, Priyanshi, absolutely right. After that, now take each of them and tell me the pathogenesis of each of them and clinical features of each of them. That's it. So let's start the first type, hypovolumic shock. Among the 3 types of shock, it is the most common type. It is the most common type. If you want me to answer in one word, it is due to decreased blood volume. That is hypovolumia, decrease blood volume. So normal blood volume is 5 liter. If it is less than 5 liter, it can lead to this type of shock, right? Now, it is divided into 4 categories. If how much blood loss is there? So out of the 5 liter, if 1 liter is lost, 1 liter is lost, 4 is still there, 1 is lost. So it is known as compensated. It will be compensated, not much worrisome. But if 1 to 1.5 liter is lost, 3.5 liter is still present in human body, it is mild shock. If 1.5 to 2 liter is lost, 2 liter is lost and 3 is present, it is moderate shock. If more than 2 liter is lost, now it is severe shock. And here saving the person is very risky. You got my, it is very challenging, you can say. So it is divided into 4 categories. Give me a thumbs up. Give me a thumbs up. Pathogenesis I have already explained you. You can see here. It is a beautiful flowchart showing the pathogenesis of all type of shocks. Start from here. Decreased blood volume. You know the reasons of decreased blood volume. What are the different reasons of decreased blood volume? You have already enumerated. Hemorrhage, trauma, surgery, burn, dehydration, diarrhea, vomiting, burns, everything. Due to all of these, start the flowchart from here. Due to all of these, what will happen? Decreased blood volume. Decreased blood volume से क्या होगा? 5 लीटर से कम है चलो blood. क्या होगा? So decreased blood volume leads to decreased venous return to the heart. Via SVC, IVC, venous return will be less. If venous return is less, cardiac output is less. जितना venous return होगा, उतना ही cardiac output होगा ना. जितना preload, उतना afterload. I guess you should have basic knowledge of preload and afterload. I am saying decreased volume is decreased preload. Decreased preload leads to decreased afterload. So cardiac output is less. That is, less blood is coming in the aorta. If less blood is coming in the aorta, less supply of oxygen to all organs. All the organs are receiving less blood, less oxygen, so all organs have anoxia and that can lead to shock. So you have to draw this flowchart in your exam, right? This is about hypovolemic shock. Now tell me the symptoms, how the patient will present to you. So patient have less than 5 liters of blood, body is trying to compensate it. That's why, you know, if less blood is there now, so this is the heart. This is the left ventricle of the heart and this is the aorta coming out of it. This is aorta, right? And this is supplying blood to all the organs. Lekin the problem is that there is less blood in the aorta. Aorta has less than 5 liter of blood. That is the problem. The left ventricle is pumping properly. There is no problem in the pumping of the left ventricle. But the problem is that कि blood ही नहीं है. हाँ, pump तो हो रहा है, लेकिन blood नहीं है तो क्या pump करेंगे, right? So it is pumping adequately, you know. So there is no problem in systole, but the problem is that the volume of the blood is less, right? So heart will try to compensate it by increasing the heart rate. So heart rate will increase, you know. So pumping will, you know, pumping is adequate, but you know, the cycle will increase, the heart rate will increase. So patient presents with tachycardia due to compensation. Patient presents with tachycardia. If you measure the pulse of the patient, you will find it is more than 100, 120, 130, maybe anything. It is tachycardia, number 1, as a compensation. Number 2, if you measure the blood pressure, so blood hi kam hai na, you will put a cuff here and you will measure the pressure of the blood. So blood is less, so blood pressure will be less. You got my point? So patient will have less blood pressure, hypotension and tachycardia. So this deadly combination. What is the combination? Blood pressure is low, but heart rate is more. So both these things as a combination you will get in hypovolemic shock. Give me a thumbs up. Give me a thumbs up. Yes, the patient have tachycardia and hypotension, right? Now, as I have told you, okay, the diagram is already there. See, this is the left ventricle. Less blood is there now. It is pumping properly. So less blood is going in aorta. So all the organs will receive less blood. But which is the most sensitive organ? Which is receiving less, on receiving less blood, it will respond. Kidney. If the kidney receive less blood now, kidney will go in failure, acute renal failure, both the kidneys. And patient will come to you with oliguria or anuria, no urine formation, because kidneys are receiving less blood, right? So glomerular filtration rate will be reduced. So patient will have oliguria and brain will receive less blood. So patient have altered mental status. Patient will be agitated, confused, lethargic, unable to respond. If you ask the patient, what's your name? He will not respond properly. You got my point? So these are the symptoms patient will come to you, right? Patient is having tachycardia, patient is having hypotension, patient is having oliguria or anuria because of renal failure, and patient is having altered mental status because of less blood to the brain. Give me a thumbs up. These are the 4 symptoms of hypovolemic shock. Yes, Priyanshi, absolutely right. Give me a thumbs up. Give me a thumbs up, right? Now, there are 3 stages in hypovolemic shock. Stage 1, 2, 3. In stage 1, it's known as mild hypovolumia, right? Patient have only tachycardia, nothing else. Patient have only tachycardia. Body is trying to compensate ना by tachycardia. So if blood loss is less ना, so patient को treatment की जरूरत नहीं है. Patient tachycardia से compensate कर लेगा and new blood formation will take place. Fluid retention orally दे सकते हैं and patient will compensate. This is mild hypovolumia stage 1. Only tachycardia is the presenting feature. But moderate may along with tachycardia hypotension will also occur. Right, here patient requires hospital admission and proper treatment. Right, fluid will be given in the hospital by IV route. And severe hypotension may patient have hypotension, tachycardia and disorientation also, acute renal failure also. So that's all about hypovolemic shock. If you get a short question in exam on hypovolemic shock, you have to write the causes, you have to write the clinical features. First of all, you have to write the etiopathogenesis, the flow chart. The etiopathogenesis, the causes, the clinical features and the stages, the 3 stages. If you write all these under headings now, you will get full marks or near full marks in your exam. Give me a thumbs up. You got it? Can we go ahead? So that's all about hypovolemic shock. And if you are getting long question now, you have to write all these for all shock. The same story, this 4 headings for hypovolemic shock, the same 4 headings for cardiogenic and same 4 headings for septic. One by one you have to write and in the end you have to compare all 3. So you will get full marks in the long question. So if you are getting short question, you will get on one of the shock. If you are getting long question, you will get on all the shocks. Right? Anyways, coming on the second type of shock. The second type of shock is cardiogenic shock. Of course, cardiogenic. As I have told you, it is also known as normovolumic shock in contrast to the previous one. Here, the blood volume is absolutely normal. Patient is having 5 liters of the blood. Absolutely normal blood volume, right? The problem is that inadequate pumping of the heart. The left ventricle is not pumping properly. The systole of the left ventricle is not adequate. It is not as vigorous as it should be, right? So inadequate pumping of the left ventricle is there, right? So when 40% of the left ventricle is destroyed, then this shock will occur. At least 40% or more of the wall of the left ventricle is not participating in systole, then this shock will occur, right? So you can see this is the left ventricle. Concentrate on the left ventricle here. Concentrate on the wall of the left ventricle. This is the wall of the left ventricle. I am saying at least 40% of the wall should be destroyed by the disease. The disease can be cardiomyopathy, can be MI, can be tamponade, can be anything. It should be destroyed by the disease, so it is not participating in the systole. So when left ventricle is doing systole, systole is not very vigorous. It is very loose, very weak systole. So adequate blood is not coming in aorta. If adequate blood is not coming in the aorta, all the organs are receiving less oxygenated blood. So that is the problem. Right, now what is the pathogenesis? The pathogenesis, it is acute circulatory failure, or it is also known as normovolumic shock, I have told you. So here you have to start from here. See, start the flowchart from here. In cardiogenic shock, what are the different reasons like MI, and you have to enumerate the reasons. All these reasons leads to decreased cardiac output. Decreased cardiac output, that is the left ventricular pumping is less. Decreased cardiac output leads to decreased blood flow. Decreased blood flow leads to decreased oxygen supply to the organs. Decreased oxygen supply leads to anoxia, and anoxia leads to shock. Why? You know, anoxia leads to ischemia, infarction, necrosis, and that leads to shock. So this is how it leads to shock. Give me a thumbs up. Give me a thumbs up. You got my point? You have to, let me tell you the third also. Then you have to compile all 3 in one flowchart. You see, my flowchart is common, but from where? What is the starting point in each of the shock? That is different. In hypovolemic shock, my starting point was decreased circulating volume. That leads to decreased venous return. That leads to decreased cardiac output. And here in cardiogenic, I am directly starting from the decreased cardiac output. I guess you are getting my point, right? So this is how you have to tell me, right? What are the symptoms here? Here, if the left ventricle is not pumping properly. So what are the symptoms here? Okay. The left ventricle is not pumping properly. So here the adequate blood is not going in the aorta. So where the blood is going? The blood is going backward. It cannot go forward. No, the left ventricle is not pumping. So blood is going backward. By backward, it is going in left auricle. It is going in pulmonary vein and it is accumulating in the lungs. So patient have pulmonary edema. Pulmonary edema which leads to dyspnea. So this patient will come to you with the complaint of dyspnea. See, the symptoms are absolutely different. That patient was coming with tachycardia, hypotension, altered mental status. This patient is basically coming. The first symptom here will be dyspnea due to the backward flow. You got my point? Apart from which, यहाँ पे भी आपको hypotension can occur because the less blood is coming in the aorta. So hypotension will occur and altered mental status and oliguria can occur. But here dyspnea is an additional feature which differentiate cardiogenic shock from hypovolemic shock. Hypovolemic shock never present with dyspnea. But here patient will come to you with dyspnea. That is the main reason. That is the main difference. Symptomatically, you can make out. Give me a thumbs up. I guess you are getting it. Say yes. And the third and the most difficult to understand is the septic shock. Septic shock, also known as toxemic shock. The septic shock, also known as toxemic shock. The third type of the shock, right? As it is known, septic is bacterial infection. We know there are two types of bacteria, gram-positive, gram-negative. Gram-negative bacteria is known as endotoxic shock. We know because gram-negative bacteria secrete endotoxin. In microbiology, we have understood that, right? So, gram-negative bacteria secrete endotoxin. That's why the shock due to gram-negative bacteria is known as endotoxic shock. And gram-positive bacteria secrete exotoxin. We know that. I guess everyone knows it. So, that's why this type of shock is known as, caused by gram-positive bacteria, is known as exotoxic shock. So, basically, septic shock is of two types. Endotoxic shock, exotoxic shock. Give me a thumbs up. Give me a thumbs up. Initially, it was thought that gram-negative bacteria are most common, causing septic shock. But nowadays, we know due to in the recent updates it is given, it is the gram-positive bacteria which is the most common cause of septic shock, not gram-negative. So please learn that. Please learn that. Now the most difficult to understand is the pathogenesis. My question to all of you: why? Why? My question is why? Why sepsis? Sepsis due to gram-positive or gram-negative, whatever, gram-positive or gram-negative, due to any of them, the sepsis leads to shock. How it is leading to shock? How it is leading to shock? So there is no hypovolumia they are causing, right? There is no cardiogenic involvement they are causing. Still, it is leading to shock. Then the reason behind that is what? So to understand it, you have to see the flow chart, right? Now, okay, let me explain you the mechanism. Okay. Listen, I will draw it for you, okay? The gram-negative bacteria have endotoxin in them. They secrete endotoxin, the gram-negative bacteria. They secrete endotoxin. The endotoxin is lipopolysaccharide. You may be knowing that. And gram-positive bacteria have lipoticoic acid in their cell wall. So basically, this is the blood vessel of a human being. Let me draw the blood vessel. This is the blood vessel of a human being. You can see the lumen, I guess. Inside the lumen, this is gram-negative bacteria and this is gram-positive bacteria. I'm not saying both the infection are taking place simultaneously. Imagine a person having only gram-negative bacteria in the blood, or imagine another person having only gram-positive bacteria in the blood. So the gram-negative bacteria, after coming in the blood, secrete endotoxin. Endotoxin is a lipopolysaccharide, right? And gram-positive bacteria, it will lyse and the cell wall is made up of lipoticoic acid. So basically in the blood, the macrophages are present. In the blood have macrophages. The macrophages have receptors for these two. The macrophages have receptors for lipoticoic acid also, and it is having receptors for lipopolysaccharide also. So whatever is coming, either gram-negative or gram-positive, it will secrete something in the blood by causing the lysis, either the lipopolysaccharide or the lipoticoic acid, and the receptors for that is present on the macrophages. The macrophages will get stimulated. On getting stimulated, they will secrete cytokines in the blood. They will secrete cytokines in the blood. I will tell you the names of the cytokines. It is TNF alpha, interferon gamma. Many cytokines are secreted in the blood. These cytokines will cause two things. Number one, listen, very important. These cytokines will cause two things. What two things they are causing? Number one, they are causing vasodilatation of the blood vessel. Please understand, it's difficult. So this blood vessel undergo vasodilatation. You tell me what is vasodilatation? The blood vessel undergo vasodilatation, number one. And number two, increase vascular permeability of this blood vessel. Permeability. What do you mean by increased vascular permeability? Can anyone tell me? So this blood vessel, the endothelial cells are very close to each other. There is no gaps. But the endothelial cell will contract and between two adjacent endothelial cells, gaps will be created. It is known as gaps. Gaps will be created in the endothelial cells, in the endothelial lining. This is known as increased vascular permeability. So these two things will happen. Give me a thumbs up if you are getting it. First, vasodilatation will occur. First, what will occur? Vasodilatation. Now you tell me, due to vasodilatation, the blood supply to an organ will increase or decrease? Common sense batao. If I am saying all the blood vessels of complete human body undergo vasodilatation, so all the organs receive more blood or less blood due to vasodilatation? Priyanshi, Tejaswini, Yash, others, Osama, I don't know others' name. Yes, common says it will increase. Yes, of course, it will increase. So vasodilatation means blood supply to that organ will increase. So it is the only shock. In all other shocks, I have taught you the blood supply was decreasing now. Here in initial phase, the blood supply will increase. not decrease, it is increasing. It is known as hyperdynamic shock. Hyperdynamic shock. You got my point? Remember the other two shock which I have already taught you. In hypovolemic shock, blood ही नहीं है, 5 लीटर क्या 2-3 लीटर blood है, blood नहीं है. So less blood is going to all organ, not more blood, less blood is going. So if you touch the fingers or hands of the patient, they are cold in hypovolemic shock. Same occurs with cardiogenic shock. The blood is 5 liter, but it is not pumping properly. The left ventricle is not pumping. So blood is not coming in aorta. If it is not coming in aorta, all the organs are not receiving the blood. So again, if you touch the extremities of the patient, the fingers, the palms, you will feel they are cold. If you touch the hand now, it is very cold in both of that shock. But in this shock, in the initial stage, if you touch the hands of the patient, they are warm. They are warm. It is the biggest clue given in clinical question. So you will get a big clinical question that patient is having septicemia and the extremities are warm. That means the examiner is pointing you towards the septic shock. So septic shock is the only shock in which due to vasodilatation at initial stage there is hyperdynamic stage and the organ receive more blood, not less blood. So, and the extremities are warm. So you will ask me, ma'am, then how shock is occurring? How the patient will have anoxia, hypoxia? Without anoxia, hypoxia, shock cannot happen. No? It is due to later stage due to increased vascular permeability. Now, increased vascular permeability leads to gaps. ये गैप्स बन गए तो गैप्स में से फ्लूइड निकल के बाहर चला जाएगा. पहले बढ़ गया, देखो समझो हिंदी में, पहले ब्लड वेसल डायलेट हो गया तो सारे ऑर्गन में ज्यादा ब्लड गया. अब ज्यादा जाने के बाद गैप्स क्रिएट हो गए तो फ्लूइड निकल के बाहर आके इडीमा हो गया. बाहर आके अब अंदर फ्लूइड कम है. In the blood vessel there is less fluid. Most of the fluid is already exited out from the gaps and causing edema. Now there is less blood. Now less blood will lead to the same sequence. Less blood, it leads to hypoxia. Hypoxia leads to ischemia, infarction, necrosis, cell death, the complete sequence. This is how it leads to shock. I guess ये बहुत कम स्टूडेंट्स को समझ में आता है. मुझे समझने में सालों लग गए कि सेप्टिसीमिया से शॉक कैसे होता है. सेप्टिसीमिया से ऐसे शॉक होता है. सो इनिशियली शॉक नहीं होता है. इनिशियली तो हाइपरडायनेमिक स्टेज है. ऑर्गन्स को ब्लड ज्यादा मिल रहा है. बाद में ऑर्गन्स को ब्लड कम मिलने लगेगा और शॉक होगा. अल्टीमेटली शॉक होने के लिए सारे ऑर्गन्स को ब्लड कम मिलेगा तभी शॉक होगा. Right? So reason is different. Everyone try to understand and give me a thumbs up. If you didn't got it, kindly tell me. I will explain you again. You got it? So let me show you the flow chart. So pathogenesis of septic shock. The third and the last type of shock, septic shock. Septic shock occurs due to bacteria, either gram-positive or gram-negative, right? Gram-positive bacteria have lipoticoic acid, ठीक है, in the cell wall, which is a super antigen. And gram-negative bacteria have endotoxin. They secrete endotoxin, which is lipopolysaccharide. So let me show you the flow chart. Whatever bacteria it is, whether it is gram-positive or gram-negative, doesn't matter. That bacteria is going in the blood. It is present in the blood. That's why the patient is having sepsis. So in the blood, in the vessel, it is undergoing lysis. The bacteria is rupturing. So if it is gram-positive bacteria, lipoticoic acid is coming in the blood on lysis. And if it is gram-negative bacteria, lipopolysaccharide is coming in the blood. So macrophages have receptors for the both, right? Macrophages. So macrophages form complex with that. Macrophages for lipopolysaccharide. The macrophage have a receptor. The name of the receptor is CD14, right? And for lipoticoic acid, macrophage have a receptor which is known as ILR2. So learn the specific receptors for gram-positive and gram-negative bacteria. On the surface of the macrophage, these receptors are present. What I have told you. So let me draw the macrophage for you. Macrophage. This is macrophage. This is gram-positive bacteria. So on lysis, it is producing lipoticoic acid. And this is gram-negative bacteria. On lysis, on rupturing, it is producing lipopolysaccharide, which is endotoxin. So I am saying that macrophage is having receptor for both. So this lipopolysaccharide binds on CD14 receptor of the macrophage, and lipoticoic acid is binding on ILR2 receptor on the macrophage. So ultimately macrophage is activated. These all important things are for MCQs. You got my point? And you can draw the diagrams also. Okay? So ultimately it will stimulate and it will secrete the cytokines. What are the name of the cytokines? Learn two cytokines. TNF alpha, tumor necrotic factor alpha, and interleukin 1. It's not interferon gamma. I'm sorry, I told you interferon gamma. It's interleukin 1 and TNF alpha. These two cytokines will cause two things. What two things? They cause vasodilatation initially, and later on they will cause increased vascular permeability. The vasodilatation leads to hyperdynamic circulation in contrast to other two shock. In other two shock, there was hypovolumic, hypodynamic circulation. Here, so more blood supply to the organs. So organs, the hands will be warm, the extremities will be warm. And due to increased vascular permeability, there is development of edema and all the fluid will come out. So less fluid inside the vessel, inside the blood vessel. So less perfusion ultimately leads to shock. So ultimately, the reason for the shock is increased vascular permeability, which takes place later on. So give me a thumbs up. Everyone give me a thumbs up. जितने audience ना उतने thumbs up दो अभी के अभी. समझ में आया क्या septic shock? Everyone got it? Say yes. So see, gram-negative bacteria secrete lipopolysaccharide, which binds to CD14 on the macrophage. Gram-positive bacteria, they secrete lipoteichoic acid, which secrete to ILR2 on the macrophage. Ultimately, macrophage is activated. Once the macrophage is activated, it secretes mediators, the cytokines. The name, so two cytokines. What are the two cytokines? It's TNF-alpha and IL-1, interleukin-1, and TNF-alpha, tumor necrotic factor alpha. On activation, they will cause two things. Number one, they cause vasodilatation, and later on they cause endothelial damage. So they cause the leak. Due to the endothelial damage, they create gaps and they cause leak. Ultimately, it leads to septic shock. So this is septic shock. We are done with the three type of shock, but in septic shock, there are two stages. Early hyperdynamic stage, in which there is vasodilatation. Due to vasodilatation, the patient have warm extremities and increased cardiac output, more blood to the organ, which is opposite of shock. And later in hypodynamic stage, there is vasoconstriction हो जाएगा बाद में, और due to edema there is less renal perfusion. It will lead to oliguria and all. So that's all about the shock. The three type of the shocks are done. Everyone give me a thumbs up. Everyone, we are done with shock. The three type of shock. The pathogenesis is in front of you. All three type of shock. ठीक है? Do you have any problem in understanding the three type of the shock? So you want me to tell the pathogenesis of the three? What are the three type of shocks? Priyanshi, Akhil, Nidhi, Rahul, Ram, Tejaswini, Ikwara, Yash, anyone. So the first type of shock is hypovolumic. The second type of shock is cardiogenic. And the third type of shock is septic. Can you tell me the pathogenesis? Try to draw the three flowcharts one by one. So start with hypovolumic. What is the starting point? The starting point is decreased blood volume. Blood में volume ही नहीं है. Why? Different reasons are there. Due to diarrhea, vomiting, burns, hemorrhage, accident, surgery, various reasons. Diuretics, ठीक है, decreased blood volume. Decreased blood volume leads to decreased venous return. Decreased venous return leads to decreased cardiac output. Decreased cardiac output, so less blood supply to all organs, it leads to decreased perfusion. Decreased perfusion leads to hypoxia or anoxia, and anoxia leads to shock. So these are the words you have to write in the flowchart by explaining each point. Give me a thumbs up, right? Coming on the second type of shock. The second type of shock is cardiogenic. What is the starting point? Here left ventricle is not pumping properly. Left ventricle failure. Left ventricle failure due to various reasons. It can be cardiomyopathies, it can be cardiomyocytis, it can be MI, it can be cardiac tamponade. Various reasons are there. So enumerate the reasons, all these things leading to here this, and all these things leading. The starting point is left ventricular failure. So left ventricular failure directly leads to less cardiac output. You can combine. So less cardiac output, it leads to less perfusion. Same. Less perfusion leads to anoxia, and anoxia leads to shock. Give me a thumbs up. Give me a thumbs up. So starting point is different. You can compare. Here the starting point is this, and here starting point is this. Rest of the flowchart is same. You can make a common flowchart also. Give me a thumbs up. Give me a thumbs up. Coming on the third and the last type of the shock. The third and the last type of shock, the difficult one, is septic shock. So on one side, write down gram-positive bacteria. On other side, write down gram-negative bacteria. Below gram-positive, write down lipoteichoic acid. And below gram-negative, write down lipopolysaccharide. Right? Make a macrophage here. On the surface of the macrophage, the receptors for the two are present. You know the name of the receptors also. It will get activated. On activation, it secretes cytokines. It is TNF-alpha and interleukin-1, right? So they will cause vasodilatation. Initially vasodilatation, that is hyperdynamic stage, that differentiates this shock from the remaining two, right? After that, there is increased vascular permeability. Increased vascular permeability creates gaps from which the fluid will go out, causes edema, and again it leads to decreased cardiac output. So decreased cardiac output because the blood is less. Now most of the fluid is outside the blood vessel, not inside the blood vessel. So less cardiac output, less perfusion, anoxia ultimately leads to shock. So see, the starting of all of these is different, but the end result is common. all these shocks leads to less cardiac output due to different reasons. Less cardiac output leads to anoxia. Anoxia leads to infarction. Ischemia leads to infarction. Infarction leads to necrosis. Necrosis leads to cell death. Cell death leads to organ failure, one organ failure. After that, multiple organ failure. After that, body failure, and after that, shock. So that is the definition of shock. I guess everyone got it. Yes. So I'm not repeating the same things again and again. So all the shocks are done. The pathogenesis is important. Clinical features are important. You will get big clinical questions on that. So seeing the symptoms and seeing the clues given to you. Whenever cardiogenic shock will be given, they will always give you dyspnea. The patient presents with dyspnea, right? Whenever they will give you septic shock, they will use the word warm extremities. The patient is in shock with warm extremities. It has to be septic shock at initial stage, right? So this is how, taking the clues, you have to identify. Give me a thumbs up, right? So all these three types of shock, whether it is hypovolemic shock, whether it is cardiogenic shock, or whether it is septic shock, they have three stages. Compensated stage, which is known as non-progressive. The later on decompensated stage, which is known as progressive. And last one is irreversible. So here, death is inevitable. Death is inevitable. The person will die even on treatment, right? So compensated, no treatment is required, right? The body is already compensating by doing tachycardia and all, right? By secreting adrenaline, right? By sympathetic stimulation. Decompensated treatment is required, hospitalization is required, but on giving treatment, you can save the patient. And already irreversible, if already all the organs are dead, they have multi-organ failure already occurred. Now, even on giving treatment, you cannot reverse it, because necrosis is irreversible. You got my point? So even on giving treatment, death is inevitable and you cannot stop it. So there are three stages. I guess you got it. So compensated. So cardiac output and BP are still maintained. Body is compensating. So body is compensating by doing vasoconstriction. So tachycardia will be there. In all types of shock, cool extremities will be there, except septic shocks in which warm extremities is there. Body will secrete, the kidney will secrete renin. So renin-angiotensinogen pathway will come in the role. And adrenaline will be secreted, catecholamines will be secreted, and body will have sympathetic stimulation. So body is compensating in the compensatory shock. Septic shock is different from all other shock because of vasodilatation and warm extremities. That is the opposite of all shocks. I had told you many times. The second stage is the decompensated shock. Here, decompensated ischemia already started, but necrosis have not yet occurred. You can start the treatment. You can start the treatment early. And irreversible, the necrosis already occurred. No recovery will take place even on giving treatment. And death is inevitable. Multiple organ failure already occurred. So these are the three stages of shock. Yes, you got my point. So yes, Rahul, you got it? Yes. So anyone else? Any other doubt? So that's all about shock, right? So all the organs in human body, they have hypoxia. Due to hypoxia, they have various injuries. Like in brain, there is hypoxic encephalopathy. Brain receive less oxygen, the brain will have hypoxic encephalopathy. The pituitary inside the brain will have necrosis. The lungs will have ARDS. The heart will have MI, necrosis. Liver will have hypoxic damage. Gut will have enterocolitis. Pancreas will have necrosis. Adrenal will have hemorrhage. Kidneys will have acute tubular necrosis, ATN. So all the organs undergoing multiple organ failure due to hypoxia. Hypoxia, or say better word is anoxia. Anoxia, right? So the core of the shock is the word anoxia. But what is leading to anoxia is different in different types of shocks. So that is all about shocks. I guess we are done with shock. You know the definition. Everyone give me a thumbs up if you know this definition. What is shock? It is not a disease. It is a clinical syndrome. It is a clinical syndrome. Say yes. You know the classification. And in each of them, you know the pathogenesis of each of them. The starting point of each of them is different, but all of them continue with low cardiac output with the same flowchart. Everyone give me a thumbs up. Say yes. And septic shock was different, that I have told you separately. So that's all about it, right? So here I would like to stop. If you still have any doubt, not only in this topic, any topic of patho, pharma, micro, PSM, medicine, I teach these 5 subjects. And apart from that, any study related doubt, like you are unable to make a schedule, or you don't have some important questions for your exam, you don't have orientation the exam you are targeting. So you are free to ask your doubts on this number. It's 9833032948. You are free to text me. You are free to text me either on WhatsApp or on Telegram. Whenever I will find time, definitely I will reply you, right? And if you have any topic in your mind, like which is you are finding difficult in patho, pharma, micro, and you are unable to understand it, and you want me to teach that topic in the free classes in the YouTube, kindly text me the list of the topic. I will try to schedule them as soon as possible. Don't forget to tell me your college name, your university, and your probable exam dates, whatever exam you are targeting, right? So my classes are basically for second prof MBBS student for their university exam hitting. But of course, they are beneficial for competitive exam aspirants also, because if your basics are clear, then only you can solve your MCQs. You cannot learn MCQs. You have to understand them. That is the new pattern, no? In the next, rectification is gone now, right? No rectification. Conceptual, basic, integrated learning. So that the three subjects forms the core. You cannot understand medicine if you don't know pathology. You cannot understand medicine if you don't know the pharmacology. If you combine patho plus pharmo plus symptomatology is equal to medicine. So medicine is nothing, it is a combination of patho and pharma. That's it. That's I understand, right? And microbiology, of course, it is a core subject. Yes. So you should have an orientation about these. Anyways, thank you very much. If you like the lecture, don't forget to click on the like button before leaving. Please subscribe my YouTube channel and please press the bell icon if you want to get notification for all the free classes daily, right? And please in this lecture also see the comments. The first comment is pinned message. It is a link provided to you, the link tree. This is my link tree. Please, you also click on the link tree. You will connect with me on all social media platforms. You can connect with me on Insta. You can get added in my WhatsApp group for getting the notification of the free classes, and you can connect with me on the Telegram. You can connect with me on Facebook, on my YouTube. All the links are provided here. Please, you join me on all social media platforms and copy this link and share with all your friends, colleagues, seniors, juniors, basically all medicos throughout the globe. Because yes, so please help me in this mission. Thank you so much. I would like to stop here. So yes, definitely I will take all these sessions one by one. Don't worry, hypersensitivity, chemical mediators, definitely. Don't worry, stay tuned for the same. Bye-bye, study hard, wishing you all the best. I'm ending this session.